welcome to Askimo TV. We're talking today to Dr. Raj Mallipeddi. Dr. Mallipeddi is a consultant dermatologist and dermatological surgeon based in London, in the UK. He works both the NHS and private sector and is the head of the Dermatological Surgery and Laser Unit at St. John's Institute of Dermatology, St. Thomas's Hospital. Hi, Dr. Mallipeddi, how are you?
Hi, Joanne. Thank you for having me today.
Absolute pleasure. Dr. Mallipeddi, let's talk today about the relationship between sunburns, tanning, and skin cancer. So let's start off with, how common is skin cancer?
Skin cancer is extremely common in terms of cancers. It's the most common form of cancer. 1 in 3 cancers develop in the skin, and around 1 in 5 people will develop skin cancer at some point in their lives. The most common types are basal cell carcinoma, common squamous cell carcinoma, and melanoma in decreasing frequency. In the UK, where I live and work, there will be at least 110,000 cases per year, but as with most cancer registries, this will be a vast underestimate due to difficulty in collecting the data.
What are the risk factors for the different types of skin cancers?
The risk factors are fairly common amongst all skin cancers, the main one being ultraviolet radiation, which is the biggest environmental factor. And there are many reasons why skin cancer rates are going up and have been in recent decades, but environmental or behavioral changes will play a huge role in this. As we all know, people enjoy sunny holidays. There's a trend to appear tanned, and sunbed use, of course, has been quite prevalent in recent decades. Other factors to do with the individual are also important. So those people with fair skins, particularly the Celtic skin type, for example, ginger hair, freckles, blue eyes, family history of skin cancer, and other health factors such as being immune suppressed. So people who have had organ transplants, such as kidney transplants, will be on medication to suppress their immune system. And this will mean that they're unable to cope with damage to the skin in the same way someone who isn't on those medications can. And this is another very important factor.
Dr. Mallipeddi, talk us briefly through a self-examination that someone could do at home to see if a trip to the doctor may be required.
Well, it's important, obviously, to examine all of the skin, but I think it's difficult for anybody at home without a basic degree of knowledge to know what they're looking for. One of the most difficult things is to know whether something has changed or is new, and unless one's monitoring regularly, it's quite difficult to map whether something is new or something has changed. We don't look at our moles on a regular basis, and we don't necessarily have evidence of what they look like at a certain point in time. So one of the things people can do is, if there is a particular lesion or mole or blemish they want to monitor, is take a photograph, and they will then have a baseline reference point. In terms of what to specifically look for with regards to moles or pigmented lesions, there are certain mnemonics. There's the A, B, C, D rule. A is asymmetry, B is for irregular border, C is a change in color, D is diameter, so more than 6 millimeters, E is elevation, so a mole that was flattened has become enlarged. It's also very important to check for itching, bleeding, which are separate symptoms, of course. With non-melanoma skin cancer, i.e. those lesions that are not pigmented, it may just appear as a sore, which doesn't heal. a break in the skin, a scaly red patch. In the case of basal cell carcinoma, classically it's a pearly nodule with blood vessels on the surface that may bleed when it's knocked, or just doesn't go away like an ordinary spot would. With squamous cell carcinoma, these can be scaly patches or lumps, which are very hard to feel. So what to look out for will vary based on what the type of cancer is. And it's not just moles which one needs to be aware of. Having said all that, one mustn't panic. Most skin lesions are harmless, and we all get growths as we get older. There are lesions such as seborrheic keratoses, which are extremely common, can look very nasty, but are completely harmless and have no malignant risk. So it's important to put it in perspective. However, it isn't just moles, as I say, that one needs to look at. And in fact, even melanoma tends to appear as a new lesion, a new mole, if you like, rather than one that's been there for years that suddenly changes.
What's the relationship between sunburns, tanning, and skin cancer?
Well, melanocytes are the pigment-producing cells in the skin, hair, and eyes that determine their colour. And it's protective. However, overexposure means that the DNA within the cells is damaged. So darker skin types are more protected for that reason, but there is a limit. And when those cells which are abnormal multiply, you develop a skin cancer. So tanning is, certainly excessive tanning is not advised. And people who suggest that sunbeds may help, for example, with vitamin D, may not appreciate that most tanning devices primarily emit a type of UV radiation called ultraviolet A, which is relatively inefficient in stimulating vitamin D. And so the risks actually outweigh the benefits. So the answer is that burning, intermittent burning, is clearly not good for the skin, but also cumulative sun exposure is also a factor. So those people who don't necessarily burn but have regular exposure with holidays every year, or even more frequently, will have a cumulative risk over their lifetime. And one of the problems is that that risk won't manifest for many years or decades later. So someone who sunbathes a lot as a teenager or uses sunbeds in their 20s may not feel the repercussions of that until they're in their 40s or 50s.
Just to end off, I think the most important question is, how can we look after our skin and prevent skin cancer?
Well, the one thing we can all do is be careful in the sun, be smart or sun smart, and that would involve using sunblocks, but not just putting sunscreen or sunblock in the morning and then forgetting about it, but topping up when appropriate, so on sunny days or when you're on holiday. Avoiding the peak times of the sun, so between, say, 11 a.m. and 3 p.m. Wearing hats, covering in the shade, wearing clothing that's more protective, and being aware that when one may go swimming or skiing, for example, and it's not necessarily hot, it's the sunlight that's still doing the damage, and to ensure the sunscreen is being applied. And for one's children to be particularly careful, as most of the damage occurs in childhood.
Thank you, Dr. Mallipeddi. Thank you so much for talking to me today.
Thank you very much.